Hello, this presentation as you can see is on hypertension, also known commonly in India as high BP. Why is it so important to know if you have it? And why should you even care? Let's find out. So what exactly is blood pressure? It is a pressure that's exerted by blood against the blood vessels, the arteries. And what is considered to be normal blood pressure? 120/80 or below. This number should be etched in your memory. Now there is a term called prehypertension. If your blood pressure, let's say, is 136/84, that is prehypertension because it is not 120/80 or below, but it is not necessarily high. So this is the range when you would call the blood pressure to be borderline. The readings again are for the top number between 120 to 140 and the bottom number between 80 to 90. Now both numbers do not have to be in this range for it to be considered prehypertension. It can be one or the other. Let us say your blood pressure is 120/89, that too is prehypertension. The reason why this term prehypertension is used primarily is not so much for treating with medicines, but to alert you and warn you that if you do not take the right steps at this point, then there is a great chance that you will end up having high BP soon. So high BP then would be any blood pressure that's more than 140/90. For the diagnosis to be made, the reading has to be over 140/90 consistently for a certain period of time. Now, why is high BP so important? Why do we consider it to be dangerous even? First thing you'll need to know about high BP is that most people who have high BP will not have any symptoms whatsoever. So unless you get your blood pressure checked periodically, there is really no way for you to know if you have high BP or not. Uncontrolled high BP can cause any or many of the following. Of course, it is the leading cause for heart attack and for heart failure. Now, these two conditions are different from each other, as I've discussed in the previous presentations on this YouTube channel. High blood pressure is also the leading cause for stroke, which is also, you can consider that as brain attack. High BP is the leading cause of kidney failure, necessitating dialysis for many and kidney transplant for the fortunate few who are able to get it done. Multi-organ damage can result from high BP, which is uncontrolled. Poor circulation certainly can result from high BP. Loss of vision and blindness can be caused by uncontrolled high blood pressure, and certainly it can lead to sudden death. And there are many other complications that I am not able to elaborate in this presentation. But the most important take-home point for you at this point is that high blood pressure, especially when it is uncontrolled, is extremely dangerous. As you will see in this slide in a few minutes, lifestyle is an extremely big factor in developing high BP. Eating unhealthy food, too much fast food, junk food, fried food, eating food that is high in salt content, drinking soft drinks quite often, which tend to be very high in sodium, and not really watching how much salt you put in your food, not being active physically, being sedentary at work and also at home, being overweight, not having enough time to relax, dealing with a lot of personal or work related stress, having high cholesterol, smoking or using smokeless tobacco in the form of gutka or pan masala, zarda pan, drinking alcohol in excess. These are all, I would say, lifestyle factors that tend to cause or hasten the development of high BP. Now, family history certainly can contribute, and advancing age certainly can play a role in developing high BP. By following an unhealthy lifestyle pattern, what we are actually doing is we are making it a lot easier for our bodies to develop this problem called hypertension. And lastly, I'd like to mention that not getting regular checkups is an important risk factor for developing high BP, only because there is this condition called prehypertension that we just talked about. Now, if this is detected and you understand that you have that tendency for developing high BP, you understand the risks of getting high BP, the problems associated with uncontrolled high BP. And if you implement lifestyle changes, there is a very good chance that you will not get to that point of hypertension in your life. The important thing to remember though is that if you do not go for a regular checkup, if you do not get your blood pressure checked periodically, there is no way to know if your blood pressure is borderline, high or normal. Now almost everyone knows that high salt diet means high BP, and a lot of times you get this advice that if you want to get your blood pressure under control, you better watch your salt intake, which is absolutely true. Now salt or sodium is hidden in many foods. You may not think of it as salt, but it is still there. For example, some of these foods you may recognize as having high salt content, but some of them you probably would not have any idea that they are indeed very high in sodium or salt content. Bakery foods including bread, fast food of any kind tends to be high in sodium or salt content. And when you eat tomato ketchup, and you do so on a regular basis, you eat soy sauce, you eat pickles regularly, very high salt content. And various snacks that we tend to eat. Here I'm talking about the very famous Indian snacks that people eat, dry snacks, chudwa and save, those kinds of things that people tend to eat as an evening snack. They also have high to very high sodium or salt content, and soft drinks the same. Not only do soft drinks have a lot of sodium, they provide empty calories, meaning you're drinking basically carbonated sugar water with sodium and absolutely get no benefit from doing so, because they have really literally zero nutritional value. Now milk and curd tend to have sodium, medium quantities, and raw meat, fish, poultry have low sodium content, and raw vegetables and fruits have very low sodium content. Fruits are extremely important for people who have the tendency for developing high BP, who do not want to get high BP in their lifetime, and also for people who already have high BP and are taking medicines for it. We'll talk about that in a few minutes. What I'd like to suggest to you is this: why don't you set a goal of cutting down your salt intake by 50%? And in order to do this, you would have to eat home cooked food, because outside food there is no way you can control the salt content in those foods. So if you use less salt than you are normally used to, when you or a family member is cooking dal, making curries and doing other stuff at home, then there is a good chance that your sodium content in diet will gradually go down to the point where it will stop being a risk factor for you. Just as high sodium or high salt content in your diet is responsible for raising your blood pressure, high potassium in your diet is responsible for reducing your blood pressure. And we are quite fortunate that these high potassium foods are easily available. And as I just mentioned, potassium containing foods, fruits are especially high in potassium content, bananas, oranges and melons being the prime examples. But whatever fruit seasonally available is absolutely fine to eat. Green leafy vegetables, extremely high in potassium content. Make sure that they are a part of your daily food intake. Tomatoes also have high potassium content, and all kinds of dals, lentils, such as kabuli chana, etc. And unsalted nuts. You can have a handful of nuts every day, provided they are not roasted in any kind of oil and provided they are unsalted. If you eat salted roasted nuts, you will probably lose the health benefits because of the sodium that you're going to ingest along with the other good stuff from the nuts. Fish too has high potassium, and low fat milk and curd, good for you in terms of not just potassium but also providing the very important calcium and vitamin D. So I put low fat specifically because milk is available with different saturated fat content. If you stick with skimmed milk or low fat milk, you will get all the benefits of milk minus the fat. I've mentioned this time and again, home cooked food is the best. This is the mantra that I'd like everyone to adopt, and you'll reap benefits from this tremendously over the years. And this I mentioned already, make sure that you eat fruits, and having 2 to 3 fruits every day, whatever is seasonally available, is extremely good for you. There are some tests, basic tests that everyone with high blood pressure with a diagnosis of high BP should have done at baseline, meaning when the diagnosis is made, and then periodically based upon the physician's advice. And these tests are fasting blood sugar test to detect diabetes or pre-diabetes, lipid profile to assess your cholesterol and triglyceride levels, electrolytes, serum electrolytes to check your potassium, sodium and other levels, creatinine and GFR, as well as urine microalbumin test to estimate or assess your kidney function, hemoglobin to look for anemia, a baseline ECG, and whatever additional tests that your physician thinks are necessary. So what exactly should be the treatment for high BP? Lifestyle, being the major risk factor, is the key for success. So these changes are a must. Eat healthy, eat home cooked food, fruits every day. Try and reduce your salt intake by 50% over the next several months and stay at that level. Absolutely say no to fast food, junk food, bakery food, soft drinks. Drink plenty of water, good for you. 30 to 45 minutes of physical activity to be a must on a daily basis. Practice meditation, it will relieve stress, tension, and give you power to get you through the day and keep you calm. Quit smoking if you're a smoker. Do not use any other form of tobacco either. And reduce or stop alcohol consumption altogether. Physical activity, it goes without saying, we just talked about it briefly. Are any of these you? Do you say, I stay too busy with my job or at home? I just don't have enough time for exercise. I have to take care of my family. Where is the time? Now, I do go for a walk, but it doesn't happen every day. My body hurts, I have all these aches and pains, and I really cannot exercise much because of that. Or do you say, I don't think staying active is really that important. I'm taking medicines, so what's the need? Let me ask you a question. What is that one treatment that is cheap, relieves stress, increases your energy level, has 0 side effects, and is guaranteed to work? You must have guessed it by now. Physical activity for at least 30 to 45 minutes every single day. This in addition to what you normally do throughout the day as part of your daily routine. Let's talk briefly about the role of medicines in the treatment for high BP. Most important thing you will need to do is to find a qualified doctor who will listen to your concerns and spend some time explaining what the treatment means. And a lot of people will need medicines for managing their high BP. And make sure that you know the purpose of each medicine being prescribed. If it's a combination medication, make sure you know that too. Inquire about any important side effects. Of course, all medicines have side effects, but it is your physician's responsibility, and in fact, your responsibility also to find out from your physician about any important side effects that you will need to be aware of. And one very important point that I'd like to mention, I've also mentioned this in some of my previous presentations, is that many medicines for high BP are available in a generic form. Generic medications are as effective but a lot cheaper than brand name medications. And ask your doctor to prescribe generic medicines. They sometimes can be as much as 60 to 70% cheaper than brand name medicines. And again, they work just as effectively. Lastly, make sure that you get your blood pressure checked on a regular basis. Make sure that you do it at least once every 3 to 4 months so you know that it is under control.